Hello, my name is Boin Lee, and Professor of Medicine, Gastroenterology, Seoul St. Mary's Hospital, the Catholic University of Korea, Seoul, Korea. So first, I am very happy to hear that our study entitled Anchoring EML versus Conventional EML for Large Nonpedunculated Colorectal Polyps was accepted to the journal Endoscopy. So as you know, incomplete resection of colorectal polyps greater than 10 millimeter frequently occurs. So endoscopic submucosal resection is an effective technique for the en bloc resection of large colorectal lesions. However, ESD is limited to lesions with superficial submucosal invasion or submucosal fibrosis because of the perforation risk, prolonged procedure time, and technical difficulty. So we studied regarding a circumferential submucosal incision before snaring, a so-called EML, a so-called pre-cut EML, and it is less time-consuming and technically easier. But in our previous study have shown that the technique does not increase the complete resection or en bloc resection rates compared with conventional EML. Anchoring EML is a kind of modified EML technique, and the only difference from conventional EML is making a small mucosal incision at the oral side of the lesion, and which is helpful for deploying the snare in a wider area laterally and avoiding from spillage during ensnaring. So this technique is very easy, and our study team members could perform very good self-learning just by watching the video sources. In our study, 105 and 106 polyps were resected using anchoring EML and conventional EML, respectively, and the complete resection rate was 90% in the anchoring EML and 75% in the conventional EML group, and the difference was significant. The en bloc resection rates for the anchoring EML and conventional EML groups were 92 versus 76%, and also the difference was significant. The procedure time of anchoring EML is comparable with that of conventional EML because anchoring EML required a small number of snaring. So now we believe anchoring EML can be considered as one of the standard techniques for the resection of large colorectal polyps. And after the study, we actually applied this technique very frequently in our daily practice. So I wish you enjoy our paper, and thank you very much.